I chose to become an epidemiologist because I wanted to change the world. And I strongly felt that information was really important for people to make good decisions about what would happen to the health of the public. I guess that I feel very strongly that basing social change and improving the lives of people should depend on facts, on real information, and not just opinion. I really do this hoping that the information that I provide will be used by someone to fix things. I have a friend whose 28-year-old daughter was just diagnosed with breast cancer, who has just completed treatment. And I look at her in a very interesting way. Of course, it's very personal, but I see her as my own personal failure. And that also keeps me going, because every single one of those cases seems to me to be potentially preventable. And if I can figure out how, if I can make even the smallest contribution to that, then I'll keep doing this. And I will stay up all night and send in grant proposals that fail and hope that someone will hear me. The experiment of involving our cohort members in our research began 4 years ago. And to my knowledge, the very first time this has ever been done. People can be worried about contaminating a study with input from cohort members. But instead what we find is just an enrichment of everything that we do. There are many benefits to working directly with the participants in the cohort on our research. What we do together is think about what questions are most important to them and try to understand how they feel when they receive communications from us. We also are very concerned with choosing problems that they believe to be important. And not surprisingly, they've confirmed their interest in the environment, which is very exciting to all of us. Funding for our PAC is really critical, and we want to keep them going. And we are adding additional generations as we go along. Right now we're working with the mother's generation, the daughter's generation, and the sons who are impacted by this disease, who are not disinterested in participating, much to our satisfaction. And we're adding the grandchildren soon, who are now adults. I'm thrilled. I feel like I've done something, because that's why I got into this business in the first place, and the fact that somebody noticed makes me feel wonderful. But more than that, it also gives recognition to all the other people who stand behind what I've done. My current staff, the former directors of this cohort who are now deceased, Dr. Rishalmi, Dr. Bea Vandenberg, who had faith in me, and our PAC, who are really, really excited about the idea that something they have done has been seen by the outside world as important. And this is a way to empower the people who want to change the world, to tell them thank you and to notice, and I thank you for that.